Welcome to PHI, Public Health Impact, brought to you by the University of Georgia's College of Public Health. I'm Phaedra Corso.
And I'm Cham Dallas, and today's episode will be on cancer prevention, a topic I think will be of importance to just about everyone watching this, since cancer impacts nearly every family at one time or another.
And we'll be talking about many different kinds of cancer today: skin cancer, breast cancer, prostate cancer. Let me ask you, Cham, what do you think the leading types of cancer are in the state of Georgia?
Well, I know lung cancer is very important here in Georgia. In fact, we use lung cancer as the venue to introduce Public Health Impact, this series.
You're right, Cham. Lung cancer is the #2 cause of cancer among both men and women, and I clearly remember the epidemiologist telling us that the rates of lung cancer among women are now reaching the same level as men.
In fact, there are many specific types of cancer that seem to be related or occur more in males or females, depending on the cancer.
Like breast cancer for women.
Or prostate cancer for men. So what other types of cancers are important now?
Well, colon cancer is also an important type of cancer here in Georgia and nationally. And one of the things that we'll be talking about today is the influence that race ethnicity has on that type of cancer.
For instance, black men are twice as likely to get prostate cancer as white men.
Well, the good news is that public health is making really important strides in the area of cancer. And we'll be talking to researchers today who are doing important bench science research all the way to community level interventions to prevent cancer.
Well, I'm really looking forward to today's episode as Phaedra interviews the cancer scholars in biostatistics and epidemiology that are participating in this cancer research program here at the University of Georgia that's making significant progress in cancer prevention.
We're now being joined by Dr. John Vina, who is professor and head of the Department of Epidemiology and Biostatistics here in the University of Georgia's College of Public Health. And to remind our viewers, epidemiology is the study of the distribution and causes of disease and injury in human populations. So it's a perfect field for us to be discussing cancer today. And so, John, we know the word cancer. Everyone has heard it before. It's a terribly frightening word for many of us. But can you tell us exactly what is cancer?
Yes, Phaedra. Cancer comes from cells that go wild in their uncontrolled growth and division. And so all the cells of our body, our skin or the lining of our GI tract or our lungs, those surface cells called epithelial cells, 80–90% of cancers come from those cells. There's a gradual increase of those cells, and they create a growing mass called a tumor.
And so are all tumors bad?
There's two types of tumors. There's benign tumors, and those do not spread, and they're not a threat to life. Whereas malignant tumors are the type of tumors where the cells break off from the mass, and then they can spread to other parts of the body.
Well, I certainly don't want to have a malignant tumor. So, John, help me know, what are the causes of cancer?
Yes, as an epidemiologist, our role is to study the causes of cancer, and the primary prevention relies on knowing what those causes are. And so the causes of cancer are three types. There's lifestyle, which is related to diet, nutrition, physical activity, and smoking and alcohol intake. The second group is environmental risk factors, and that's related to where we live, where we work, exposures that we get in every day, water pollution, air pollution. And the third one is heredity, and that's where you either inherit the genes that put you at risk of cancer, or you have genes that reduce the risk of cancer.
So if we're exposed to any of these three risk factors that you've told us about, what can we do to prevent cancer from forming?
To decrease your risk, it's important to maintain a healthy weight, get 30 minutes of physical activity a day, don't smoke, eat a healthy diet, limit your alcohol consumption. A really important one is protect yourself from sun exposure because of skin cancer. Protect yourself from sexually transmitted diseases because there are some viruses like papillomavirus that causes cervical cancer.
And are there certain symptoms that we should be looking for that would suggest that we might have a cancer?
Secondary prevention is diagnosing the cancer early and catching it early. So that means if you have signs or symptoms, it's really important to go to the doctor. And the signs and symptoms that are really important are a change in your bowel or your bladder function, a sore on your skin that doesn't heal, that doesn't look right, unusual bleeding or discharge, thickening or lump in the breast or anywhere else where you feel that there's a growth, indigestion or difficulty swallowing, and then another main one is coughing or hoarseness in your voice. So those are the kind of leading signs or symptoms that could be related to cancer. So it's important to then go to the doctor.
So John, I understand that there are quite a few cancer researchers here on UGA's campus. Can you tell us a little bit more about them?
Phaedra, we have 4 distinguished cancer scholars funded by the Georgia Cancer Coalition here in the College of Public Health. And we're all members of the Cancer Prevention and Control Program of the Georgia Cancer Center. Myself, I have done work in cancer epidemiology, including studies of breast cancer and colon cancer, looking at environmental and occupational risk factors for those cancers. We also have Dr. J.S. Wang, and Dr. Wang is in environmental health science. He's professor and head of that department, and he does work in liver cancer and esophageal and colon cancer and looks at important risk factors and biomarkers for those diseases. We also have a biostatistician, Dr. Kevin Dobbin, who helps us develop methods in analyzing both clinical trials and investigations, and he also works with Dr. Pierce in the Cancer Center looking at biomarkers. And then there's Dr. Claire Robb, who is a cancer epidemiologist, and she's interested in what happens during the process of treatment and survivorship issues, in particular among elderly cancer patients. And so we're all members of the Cancer Prevention and Control Program of the Georgia Cancer Center, which is directed by Dr. Mike Hawkeye Pierce.
Sounds like a great group of researchers you have here, John. So when we come back, we'll be looking at another cancer research lab here on campus, and we'll be talking to Dr. Mike Pierce. The UGA Cancer Center has over 50 faculty members that encompass many schools and centers, including the College of Public Health, Pharmacy, Vet Medicine, the Franklin College of Arts and Sciences, Journalism and Mass Communication, the Institute of Bioinformatics, and the Complex Carbohydrate Research Center. And today we're visiting with the head of UGA's Cancer Center, Dr. Mike Hawkeye Pierce. And Mike, tell me where we are today.
Well, Phaedra, we're in one of my laboratories here at the Complex Carbohydrate Research Center. Here you see lab benches where we have many students, undergrad and graduate students, postdoctoral fellows, and research associates and faculty working at the benches.
So I'm interested in knowing what kind of research projects you do here in the UGA Cancer Center that are in collaboration with my colleagues over in the College of Public Health.
Well, we have many collaborations with folks in the College of Public Health through the departments of biostatistics, epidemiology. We have interactions with the basic scientists that are in the College of Public Health as well. So there's a great deal of collaboration between all of our members of the Cancer Center.
And how many members of the Cancer Center are there?
Well, we have over 50. We have some new folks that have just come here new this year and are applying to become members. So we'll probably be around 55 to 60 members across campus in many departments.
So tell me, Mike, what distinguishes the UGA Cancer Center from all the other cancer centers in the United States and maybe even internationally?
Well, we've developed one program here that I think is really unique, and we call it the Cancer Cell Targeting Program. And so we've developed technologies here to look at molecules on the outside, on the surfaces of cancer cells. And that's really important because if we can find those markers, then we can develop those into potential ways to tell us if a person has a cancer, a blood test, or a way to kill the cancer cell.
Okay, you've got to give me a little bit more explanation than that. So what do you mean, this one particular cell?
So tumors are made up of several different types of cells, but we know now that at least in leukemias, myelomas, a lot of brain cancers, that the cancer is actually caused by a small number of cells called cancer stem cells. And they actually give rise to the rest of the cancer. And if you don't kill them, they're very resistant to standard chemotherapy because they can get rid of it very quickly. But if you can kill them, then you could keep the cancer from coming back and have a very successful treatment. And so these cancer stem cells, my analogy is it's like fire ants. So in a fire ant colony, if you want to get rid of the fire ant colony, you can kill all the workers and the drones, as many as you want. But if you don't kill the queen, the fire ant colony is going to come back again. So in this analogy, the cancer stem cell is the queen. So we have to be able to kill the queen. And to do that, we have to find what's different on the outside of the queen or the cancer stem cell. And if we can identify that, then we can target drugs to kill those types of cells.
Wow, that's really exciting. And so is there a chance that you'll be able to target this queen cell very soon and start improving population level health?
Well, we're working in animal models now, and in the next 6 months we're going to start working with actual human breast cancer samples that we're going to get through various collaborations. So the basic research is going to move forward. The actual approval of that by the FDA for either a blood test or for a new type of drug, that takes much longer. Typically, drugs to treat cancers can take 10 years to get through all the levels of FDA approval. But we have to start now. We have to be doing this research because this is where all the potential drugs are really coming from these days is research in cancer centers and universities.
Now let's bring it back to public health one more time. What kind of research are you doing that has direct implications for improving population level health?
Well, the blood test that would really help us screen for potential cancers, people who are at high risk for cancers, that's certainly one way. Another way is we have a collaborator here in the CCRC, Dr. Boons, who's working on a cancer vaccine.
Oh, great.
So he's working in animal studies now and breast cancer, but the idea is to actually be able to inoculate animals just like you would get a flu shot that would really, really decrease the chances of at least some of the major cancers that you would get the major cancer.
Wow, that's encouraging. And so are there any other vaccines that are currently available for cancer right now?
Well, actually, there is the HPV vaccine that's just come on the market in the last year or so, and that needs to be the use of that needs to be greatly expanded. But that's really one of our first big advances. That is, of course, a virus, and we know a lot about viruses, and we've been able to develop a vaccine against them. So for various types of cancers caused by papillomavirus. That's going to have a huge impact on public health.
Well, thank you very much, Dr. Pierce, and come back in a few minutes to the next segment of Public Health Impact.